Good evening, this 4th of June. Welcome again to our talk. We are talking from She Chooses to Live platform. That's She Chooses to Live initiative is an NGO that wants to, has been given the mandate to give people knowledge so that people can make informed choices. The kind of knowledge we give is usually health knowledge because that's what we are knowledgeable in, and more specifically, reproductive health knowledge. So that's what we are sitting on that platform of She Chooses to Live. It's an NGO that is ongoing. I've said on this platform a few times that I seem to be talking to the Princess Dianas of this country, which is wasn't the initial hope. The initial hope was that I would talk to the Wajikos and even visit Wajikos physically and do pap smears too for them and teach them one or two things, like what I'm talking to people in the Princess Diana group. But Corona happened, so we haven't been able to be on the ground. We haven't been able to physically go. We hope that soon we will be able to go. We also hope that we'll be able to even virtually get to Wajiko somehow. So welcome Princess Diana's and welcome the Wajikos who can manage to log in. You're very, very welcome to this knowledge. We hope that you finally catch something and that whatever you get will be helpful to you or to your friend. Share, you have permission to share. Whatever I tell you, you have permission to share with anybody and with everybody. It would be my joy to think that some people made the right choices because of some knowledge that I imparted. So I'm happy about it. So on my left here, also part of the She Chooses to Live people is my tech guy. She's called Marion. She puts me online and removes me online. And if you ever see me not online, it's her. or the lines are down. So she is what we call the tech guy. My name is Dr. Jane Wakahe. I'm an obstetrician gynecologist. I've practiced those two fields for very, very many years, actually very many. Then I also have a degree in public health, and that's what really kind of opened to my mind that there are Wajikos in this country. I was content with just Princess Diana's in Nairobi Hospital and Aga Khan, but then I realized there are Wajikos somewhere, and they also are as deserving as the Princess Diana's, maybe even more deserving because they have no alternative. You need to give them the knowledge. The Princess Diana's can actually look for it. The Wajikos may not be able to look for it, to be in a position to look. So, yes, we've been talking several topics on this platform, mainly the ones that people request us to talk about, and some that I feel people should know when a lot of people ask them in my clinic. I am still practicing, so I still get quite a number of questions, and sometimes I address those, but most of the time I address what people ask. So kindly request some topics, then we shall be able to deal with them. So today we are discussing ovarian cysts. It's been, I think the last time we were discussing hygiene, this time we are discussing ovarian cysts. And what is ovarian cyst? First of all, what is an ovary? A woman is born with two ovaries, actually. As a girl, one is born with two ovaries. One, and they are both located in the pelvis, one on the right side, one on the left side. When their a girl is very young, they are very, very tiny indeed, almost not visible. But once one gets to what is called menarche and starts, the ovary starts being active to produce the eggs and to produce hormones, then they grow to the size of like a small plum, and the shape of that nut called almond. So those are the two, and they are situated, like I said, in the pelvis, just at the next to the entrance of the fallopian tubes. The fallopian tubes are the tubes that connect, that come out of the uterus, and you usually help to carry the egg for fertilization. So ovaries are both on both sides, and that's where they are situated in the pelvis. Uh, the the functions of the ovary are three major ones. One of them is to produce hormones, especially the female hormone. These are the ones that make you feminine, and these are the ones when they go to sleep after menopause. If you look at a menopausal woman, if you look at me, and you look at a man, we are almost alike. Uh, Whereas when I was young, I was more feminine than I am now. So this is the hormones are what make you feminine. So that's one of the functions of the ovary. The second function is to bring out, to store the eggs and release the eggs that finally make babies. That is the second major function. And the third function is it is up to the ovary to sustain the pregnancy. Once fertilization happens and implantation happens in the uterus, then it's up to the ovary to sustain that pregnancy with hormones until such a time as the pregnancy is big enough to be able to self-sustain, to be able to have made a placenta and self-sustain, and that happens at about week 14. So those three functions: one is to make hormones, two is to store and release eggs for fertilization to make the next human race, and the third one is to sustain that baby until it can be self-sustaining. So the ovaries will start being active at around menarche. These days, menarche means onset of periods. These days, we see as early as 9 years, some girls have started having periods, but they will usually start at about age 12. And every girl who is normal and healthy must start their periods by age 18. So menarche is anywhere between age 9 and age 18. If somebody is going a bit beyond age 18, then there is need to check whether the ovaries are being active or not. It's necessary that they check with the doctor whether the ovaries are being active or not. So they will have the ovaries active all the way from menarche, from onset of periods. In fact, it's the ovary that sets out an egg that doesn't get fertilized, and hence the uterus bleeds. So that's the onset of menarche. Then they will work until a woman reaches menopause, and then they'll go to sleep. They will stop producing eggs. They will stop their egg storage will have reduced to the point where they will not produce other eggs, and even their hormone production will go down very, very markedly when it reaches menopause. So that's what an ovary is. Now, what is a cyst? A cyst can happen actually anywhere in the body. It's not just ovarian cysts. There are other cysts. There are cysts on the skin. There are cysts on the liver. There are cysts over the kidneys. There are cysts in many places. There are cysts in the breast. So cysts can happen anywhere. But today we are discussing ovarian cysts. And a cyst is like a balloon, like a little balloon full of water, or like a sack full of water. This is not tap water, it is body fluid. So it's a sack full of body fluid. Now, there are good cysts, good ovarian cysts. Today, when I say cyst, I'm talking about ovarian. The other cysts may be good, maybe not good, but I'm not talking those. Today I'm just talking ovarian cysts. So there are good ovarian cysts. And which ones are these? Every month, from menarche, from onset of periods to menopause, every month, in normal circumstances, a woman produces an egg. Now, what the ovary does is it makes a little balloon in itself, in its skin, makes a little balloon full of water and floats that little egg that it wants to release into the balloon. And then when the balloon gets big enough, it bursts and lets out the egg. And the egg then goes to the fallopian tube in the hope of being fertilized. So every month, a woman makes a small cyst, makes a cyst, which is called a follicular cyst. And when, like I said, when it's big enough, then it bursts and discharges its egg into the fallopian tube. Now, sometimes this follicular cyst will not burst for whatever reason. It may be that it may be that the covering of the cyst is a bit harder than usual. Sorry, just a minute. Pausing there to take a bit of water. I keep telling us all that water is very, very healthy. So a lot of water is necessary. So for whatever reason, this cyst may not burst and let out the egg. In fact, if it doesn't burst, then the egg dies in there. And this cyst keeps growing bigger and growing bigger and growing bigger. And that can be finally what is called a simple cyst, which has grown too big. Usually the normal one will reach 2 centimeters and burst to let out an egg, but sometimes it's not able to burst and it will grow bigger. So that is a useful cyst, follicular cyst, and it should be routinely it bursts. Sometimes it doesn't burst, and we shall talk about what to do with it if it doesn't burst. The other good cyst is called a luteal cyst or a corpus luteum cyst. This is the cyst that helps the ovary do its third function. The third function, which is to sustain the pregnancy in the first trimester. Now, this cyst, when pregnancy happens and implantation happens, the ovary that was the mother that produced the mother of the egg that became the baby gets to swell quite a bit. And the reason for this swelling is to be able to make more hormones than it normally does, and to be able to give that hormone to the pregnancy and to sustain it. So this is a luteal cyst, and this cyst will help the pregnancy to stay in course until the pregnancy, again, like I said, makes its own placenta and starts making its own hormones. And usually this is about 14 weeks. So sometimes you hear us talk about hormonal needing to be given additional hormonal support, because sometimes the mother ovary is just not able to produce enough hormone to support the pregnancy. So that is a good cyst. So when we see a cyst in pregnancy, we feel very happy because that is a good cyst and it's got a good function. Now, there are cysts which are not good cysts, and outside those two, the other cysts are not good cysts. Some not so bad, some pretty bad. So the not so good cysts are divided into two sets. There is the set that is called the simple cyst. And what that usually means is that the balloon is one. If you were to take a picture of the cyst, you'll find that the balloon is just one compartment indeed. It is just one. So it's usually a simple cyst. You can see the end of it and all of it. So that's a simple cyst. and it usually be from a follicular cyst that didn't burst. Then there comes the other type called the complex cyst. What complex means is that inside that balloon there are compartments. There are several rooms in that cyst, and if there are several rooms, it follows that it is almost impossible for it to burst, because even if you were to burst one room, you will have many other rooms that are not burst. So it's if it's a complex cyst, it's likely to persist and to stay there. And there are different reasons why one can get a complex cyst. It could be an infection, it could be an endometrioma, it could be many things. So a complex cyst is not a good thing. So what are the causes of these cysts? Some of the reasons that one gets the cysts is hormonal, some hormonal imbalance. In fact, sometimes when we have some little simple cysts, we'll give a balancing of hormones with the pill, with the contraceptive pill, and sometimes those cysts will settle. So it could be a hormonal imbalance issue. It could be actually de novo in the sense that they just come. There is no explainable reason. They're just there. The other reason why they would come is if there is like when somebody is getting fertility treatment and the ovaries are overstimulated, overstimulated to produce eggs. So sometimes that is a reason for ovarian cysts. The other one is called a dermoid cyst. This is a very interesting cyst. We shall discuss it a little bit later on. It's called a dermoid cyst. This is something that actually one is born with. It grows slowly, but we shall discuss dermoid cyst a little later. Then the other reason would be an endometrioma. Soon we shall discuss endometriosis. Endometriosis means that the cells of the inside of the uterus, the endometrium is where the baby goes to implant. So endometriosis means that those cells that make the endometrium where the baby implants have migrated to outside of the uterus. And sometimes they migrate into the ovary and make an endometrioma. So when somebody is getting a period in the uterus, they are also getting a period in the ovary. So this ovary swells with blood. Is in fact chocolate in color. It swells with blood and is called an endometrioma. So that's another reason for another cause of cyst. And then finally, the baddest of them all is when it is cancer of the ovary. It will start like a cyst, an enlargement of the ovary. Now, of these abnormal cysts, they are not cancer. The other abnormal cysts, at least 10% of all women will at some point get an abnormal cyst. So it's not a very unusual thing, and it is very, very common indeed. Now, how does one know that they have an ovarian cyst? What are the symptoms? Unfortunately, there are no specific symptoms for the ovarian cyst. And the reason is that the ovary is such a tiny thing. It's a very small thing indeed. It's up to about 5 grams, 6 grams, 8 grams. You can imagine how small it is. And it is living inside a very big abdomen. You can imagine how big an abdomen is, because it's the same abdomen that is able to contain a whole baby, with the uterus, the enlargement of the uterus, and the placenta and the baby. So it's a very small something that is changing in a very big area. So it will take a lot of time for the body to notice that this is happening. And that's where cancer of the ovary is so very, very dangerous, because most of the time, by the time it is detected, it is actually so big so that it has involved other organs, and that's why it's being found, it's being detected. So, but having said that, there are some symptoms that would make you want to check whether you have an ovarian cyst in your system. So one of the commonest signs is that there is menstruation irregularity, abnormal menstruation, because the role of the ovary is to produce hormones. So if it produces hormones that imbalance the system, then the uterus can bleed abnormally. So one of the signs is abnormal bleeding. The other one is just swelling of the abdomen and bloating. Now, that is a symptom of many things. So bloating and swelling of the abdomen may be that it is ovarian cyst that is developing. The other one is that one could have pain when passing stool, when opening bowels, because if the cyst has grown big enough to sit on the intestines, or if it's an infected one that is causing attachments, what we call adhesions to the intestines, or if it is even cancer that is causing migration of cancer cells into the intestines. So whatever. So one can have a pain when passing a stool. The other one is pelvic pain. Now, a lot of women, not a lot, all of us women have pelvic pain. So it takes a bit of alertness to be aware that you don't ignore pelvic pain. I keep telling us that we'd better disturb doctors. We'd better go to our doctors and complain and be told that we are hypochondriac. That's what we call people who we think they are making signs and symptoms here in the head. So you better be called a hypochondriac than have your cysts get so big or your cancer get so big. So yes, one of the things is pelvic pain. The other one is dyspareunia. Dyspareunia, we discussed dyspareunia the other day. Dyspareunia means painful sexual intercourse. So if there's a cyst in the pelvis, that can cause painful intercourse. A more specific one, actually, that is more ovarian than many other organs in the body, is that there is a pain down the legs. If you start feeling a pain, a back pain and a pain down the legs, whether the front of the leg or the back of the leg, not the sciatica, but pain at the back of the leg or at the front of the leg, with a bit of backache and lower abdominal discomfort, that is more of a pointer towards the ovary. Then alongside with that, there can be breast tenderness, because if the ovary produces, the cyst gets big enough and produces hormones, then the breast is the change of hormones causes the breast to be tender. There can be nausea and loss of appetite. We don't want to really get to that point, because by then things are not so very, very good. But yes, nausea and lack of appetite is a reason to go and see the doctor. It could be an ovarian problem. There can be urinary frequency, in the sense that if the cyst is sitting and pressing on the bladder, then the bladder is not able to completely fill up, and it feels a little and feels like it's full, and you have to keep going. And sometimes even what we discussed the other week, I think there's a week we discussed urinary incontinence, and one of the reasons was retention, so it can block so that some urine gets out and some doesn't. So there is some urine always left in the bladder. So urinary problems can happen. There is one that somebody must never ignore. If you get a sudden sharp pain in the abdomen, very sudden, sharp, excruciating, and not going away, that may be a sign that there is what finally I'll discuss a bit later, that there is a cyst that has twisted and it causes a lot of pain indeed. The pain, the ovary pain threshold is like the testes of a man. You can imagine kicking the testes of a man. That's the same kind of feeling that if the ovary is hurt, that's the kind of pain it feels. And then one of the other signs that could suggest ovarian cysts or ovarian swelling is excessive hair growth, including hair all over the place. That would be a hormonal change that the ovary can have brought about. Now, how do we diagnose ovarian cysts? Again, not easy, because it's not something you go to diagnose. It's not like you've missed your period, you go to diagnose a pregnancy. It's not like you have a headache, you go to diagnose what is inside the head. This is a bit difficult. So sometimes, most of the time, if it's not very big, the ovarian cyst is discovered during a routine medical examination. For example, we are doing your pap smear, then we are checking inside your pelvis, and we find a swelling, and that is, we find it, there is a swelling there that shouldn't be there. And so we send you, the next step now is an ultrasound of the pelvis to check what that swelling could be. And sometimes it turns out to be that it is an ovarian cyst. So sometimes, again, even routine ultrasound, you may be being done another ultrasound for whatever other reason, maybe, and then routinely a cyst is found. So you can have specific look for ultrasound, do an ultrasound to look for an ovarian cyst if you find a swelling, or you could be doing an ultrasound for other reasons. If we find an ovarian cyst, sometimes, depending on what the doctor feels the origin is, they are likely to also sometimes to also ask for you to do what is called an MRI. An MRI is a more intense radiological checkup of the mass to decide what is what it could be and how far it has gone. The other tests that we do are things like pregnancy test. If we find an ovarian cyst, then we are likely to do a pregnancy test. If the pregnancy is very small, we are likely to do a pregnancy test to see if this is a luteal cyst, if this is a good cyst that is supporting a pregnancy that is growing. And the other test we do is a blood test. It's called CA125. CA125 is one of the tumor markers that we use. Various organs, if they get tumor, if they get cancer, we'll throw some specific things into the bloodstream that are called tumor markers, and these can be detected with the blood. So CA125, we will usually see us routinely do it in somebody who has a cyst that we are bothered about. Now, let's talk about the complications of ovarian cysts, and this time now I'm going to talk about the torsion. Like I told you, if you have a sudden, very sharp, very intense pain in the abdomen, this could be that you have an ovarian cyst, even an undiscovered ovarian cyst, and it has twisted. Now, when a cyst is very small, like if, for example, if it's 2 or 3 centimeters, it's of no consequence really. But once the cyst starts to get big, to get to about 5 centimeters in diameter, whether it is simple or whether it is complex, that cyst gets heavy enough to be able to twist the attachment of the ovary, to hold the ovary and twist it around its attachment. Now, the attachment of the ovary to the pelvis is the same one that gives the ovary blood supply, and it's the same one that has nerves to the ovary. So if this twists, torsions, we call it torsion, if it twists, there will be pain as it is twisting. Now, if it twists long enough, then it will cut off the blood supply to the ovary. And the blood supply, if it is cut off, then we know what happens. If the heart stops, we know what happens. The whole body dies. If there's blood cut off from the ovary, then the ovary will die. So if you get a very, very sharp, excruciating pain, have it checked that it's not an ovarian cyst that has twisted. If it is caught early, it is possible that surgically one can save that ovary before it gets, it takes a bit of time for the blood supply to be cut off and for the ovary to finally die. So if that pain comes and there is early enough surgery, then it is possible to save that ovary. That pain is akin to what is also ectopic pregnancy pain. So those two pains will usually need very, very quick surgery, investigation quickly, surgery quickly, to see if the ovary can be salvaged. If the ovary, if it's not removed, if the surgery is not done in time and the ovary dies, the ovary still has to be removed because you can't leave dead material in the system. So it's better to try to catch it early, to undo the torsion and remove the cyst, and hopefully have a living ovary than have none. But having said that, even if one was to lose one ovary, we shouldn't lose ovaries, we shouldn't. But even if one was to lose one ovary, the other ovary is as good as both. So there will still be, as long as there is an ovary, there will still be well supplied with hormones. There will still be well supplied with eggs that make the baby, and they will still be able to support a pregnancy when the pregnancy happens. So but of course, if we can, we want to save the ovary. So that is where torsion is concerned. That's one of the few complications of ovarian cysts. Now, management of ovarian cysts. You have now diagnosed an ovarian cyst of whatever nature it is. Now, you've either done ultrasound or MRI or whatever, and your diagnosis is that there is ovarian cyst. Now, management, I usually keep saying I do not tell people how to manage things on this platform, which is true. I don't want you to manage it online, because there is nothing you can really manage online. You can get knowledge, but you can't sit online. But having said that, if you have any of the system of the symptoms that we talked about, then your doctor will advise you what to do. And it will usually be that if it is a simple cyst, and this is a cyst, as simple, which means one compartment cyst, which is smaller than 5 centimeters, your doctor will usually tell you, let's watch and see. Wait and see whether it will burst itself. Wait and see whether it will reduce itself. So your doctor will sort of give you that kind of advice. If it is a complex cyst, you will go to your doctor, and most likely they will tell you, if it's not so big, they will do a tumor marker on it. And if, sorry, another break for water. And if it's not suspicious for cancer, then they will usually sometimes give you antibiotics and tell you to wait and see. and then later on repeat the ultrasound and check whether the cyst is going or not. Now, if it is obviously an endometrioma is that one I told you that when your period happens, then it also bleeds inside itself. So if it is an endometrioma, the doctor will advise you, if you can get pregnant, that is the answer. Because in the 10 months that you'll be pregnant, then the endometrioma will shrink. There will be no bleeding into the ovary. But if you're not in a position to get pregnant for whatever reason, then the doctor will decide whether to drain it or whether to leave it alone. So that one, it will depend on, the doctor will tell you what to do. But that has a very, very simple and very good solution, pregnancy indeed. Now, let's come to the interesting one called ovarian dermoid cyst. That is a cyst that is it's there from the time you are born. It just keeps, it will grow when the ovary starts to be active, and it's a very interesting cyst indeed. It's like something wanted to make a whole human being on their own inside the ovary. So inside this cyst, when an ultrasound is done, fortunately, it's very easy to diagnose with an ultrasound. When the ultrasound is done, then they are likely to tell you that that cyst has teeth, that it has some bones, that it has some hair. So you'll be told like that about a dermoid cyst. And it is a very, very interesting cyst indeed. Even when you remove it, we remove it and we cut it, it becomes very, very interesting to look at. Now, if it is a dermoid cyst, if it's been proven as a dermoid cyst, then your doctor will most likely, almost 100%, tell you you need to remove it. The reason is that dermoid cysts do not go anywhere. They don't disappear. They just keep getting bigger and bigger and bigger. And the second thing is that dermoid cysts can turn into cancer in time. Usually at the beginning, they are just benign, not malignant, but they can turn into cancer. So those ones, your doctor will usually advise you to have it removed. So please, if they advise you like that, just agree with them and have it removed. Now, the other one is when we suspect cancer. And this one is a bit more complex because the advice your doctor gives you will depend on how far gone the cancer is. They can tell you, if it's not very big, then they can tell you we remove the cancer as much as we can, then we give chemotherapy. Or if it has gone too far, they can tell you that we give you chemotherapy to reduce the size of the cancer and then do surgery thereafter. So that one I cannot elaborate further. It will depend on how far it is gone indeed, that when it is cancer when the swelling of the ovary is got to do with cancer of the ovary. Now, I think I've talked quite a lot, but I want to end with a few takeaways from this session. It's like I said, it's a natural thing that changes to non-natural. So that take away every month, as long as you are in your reproductive age, you are making an ovarian cyst. So the fact that you've been done an ultrasound and told that you have a 2-centimeter follicular cyst, that is normal. It is. There's nothing unusual in that. You should be making an ovarian cyst unless you are pregnant or unless you've just delivered and are breastfeeding, in which case your ovaries are still asleep, or when you are on hormonal contraception, then the ovaries do not produce eggs, so you are not then you shouldn't be having any follicular cyst. Or, of course, after menopause. After menopause, and this I must emphasize, when a woman reaches menopause, if you do an ultrasound on me, if I'm healthy, then you will find that you cannot even visualize the ovaries. They get so small that you're told ovaries were not visualized. And that is a very beautiful statement after menopause. You want to visualize them when you're young and when they are needed to produce the eggs to make babies. But after menopause, you want them to shrink so much that indeed they are not visualized. So if a postmenopausal woman gets an ultrasound and is told they have a cyst, that is usually not a good cyst. So kindly, so in menopause, you shouldn't be having any cysts. So that's one set of takeaways. Second set of takeaways is that luteal cysts are very important. When one is pregnant, unless a luteal cyst is truly twisted, torsioned, and has killed the ovary, please leave the luteal cyst there, because it's the life support for the baby. So in pregnancy, the cysts of pregnancy is good. The other takeaway is that most cysts are innocent. Most cysts, in fact, will burst on their own or disappear on their own. Most of them are actually innocent. And it's a question of if they are small or if they are complex, but most of them are innocent. The other takeaway is, like I said at the beginning, there are no specific signs and symptoms for ovarian cyst. So if you feel anything that you are not very comfortable about, again, kindly disturb the doctor. Let them check whether it's anything abnormal in your abdomen, because of course, even if it is cancer, any cancer found early is curable. So you want to not ignore signs and symptoms, just in case it could be something very serious indeed. So with those signs, kindly consult a doctor. And then because the abdomen is so big, and there is a lot of space for ovarian cysts to grow, it can get very big before you know that it is there. So and that includes, in fact, even the cancerous one. So to mitigate this, one needs to do routine checkups. And the best routine checkups is when you are doing your annual checkup, when you are doing your annual pap smear, kindly do ultrasounds. Do an ultrasound of, may list what ultrasounds you should do on an annual basis. Do an ultrasound of the breast if you are below age 50. If you're above age 50, it's easier to start the checkup of the breast with a mammogram. But if you're below age 50, do an ultrasound of the abdomen, of the breast annually. Do an ultrasound of the abdomen annually. Abdomen is where we host the liver, we host the kidneys, we host the stomach. So even if you are feeling nothing, I'm talking routine now, routine checkups, do an abdominal ultrasound, and then do a pelvic ultrasound on an annual basis, so that if anything is starting to misbehave in there, then it is caught in time. I think I've talked a lot. My throat has even gone very dry. I'm willing to take questions. I'll check if there's some. I'll get Tech Guy to come and check. Today she is there. Today she didn't lose me. So we'll check if, yeah, Tech Guy, if there are any questions, then we can answer them. I've talked until my throat is dry. But don't worry, it's not here that has made it dry. I've talked the whole day and drank water the whole day also. So, any questions, any issues?
There's a lady here called Olive Nganga.
Mhm.
She asks Dr. Jane, who is at risk of getting ovarian cysts?
Everybody, every woman. Like I said, every month a woman makes a cyst to let out the egg. But sometimes the cyst will not burst. And even if it's a simple one and it's large, it is a dangerous cyst in that it can twist the ovary and kill it. So yes, every woman, every person with an ovary is at risk of getting an ovarian cyst. As to who is at risk of getting ovarian cancers, that kind of runs in families, people who have had breast cancers, people who have had relatives with ovarian cancers, that runs in families. But cyst, every woman is at risk.
So far, that's the only question.
That's the only question.
If you want to add something.
No. My throat is even refusing to talk. Just asking, where did Jennifer Wamoyo go? I haven't seen her for a while. Yeah. I hope, Jennifer, you're okay there in Britain. It's not as nice as Kenya, but I hope you're okay.
Yeah.
So you can say bye-bye.
Yeah.
Okay.
Okay.
Okay. So bye-bye. We see you next Friday, God willing. Send us things to talk about. We shall be very willing to talk and give us ideas of how to get to Wajiko, even with these stories, how maybe to assist them with the online ability, those kinds of things. Yeah.
Right.
Hi. Bye.